Hello, I'm Luke O'Neill and here I am in my lab in the Trinity Biomedical Sciences Institute. So for this week's update, we're going to start with an interesting study, a big study on pregnancy and COVID-19, very serious, important topic of course. And if you're pregnant and you get infected, what happens? Well, again, it's a bit disturbing. There's a 3.5-fold increased risk of hospitalisation if you become infected while pregnant over people who aren't pregnant. And secondly, if you end up in hospital, there's an increased risk of preterm birth, which means the baby might get born a bit too soon. Now what this means is if you're pregnant, you're in a high risk group, be very careful, try and not pick up the virus. Adopt all the usual things, wear your mask, wash your hands, keep distance during pregnancy. It's very, very important. On the more positive side, of course, it is possible now to vaccinate people who are pregnant. The view now would be that's a safe thing to do. So again, if you're pregnant, you should be in line for the vaccine as well to protect you. And of course, the vaccine business just keeps rolling the whole time. Lots of great science happening there. You wouldn't believe the number of studies about the current vaccines and how they work and the response to them. But now a very interesting paper has just come out. So the most vaccines are the spike protein, the bit that sticks into your lungs, and that you can raise antibodies and block the spike, and that's how these many vaccines work. But now a second protein in COVID-19 called the nucleocapsid. There's a great word for you. This encapsulates the RNA molecule. It's a key sort of structural feature of the virus. This triggers a fantastic immune response, especially it brings out T cells. Now T cells are the second big set of troops we have after B cells in our immune systems, and you get a great T cell response to the nucleocapsid protein. So now of course they're thinking, let's use that in vaccines, and we may well have a nucleocapsid vaccine. Of course some of the vaccines already, the Sinopharm vaccine, will have the whole inactivated virus that will contain the nucleocapsid. Maybe that makes that vaccine all the more efficacious. So again, a new development in the effort to make new vaccines. And then of course we're looking at different countries all the time and how they respond to the virus. Sweden was in the news, as you might all remember, New Zealand, Australia. But now India is a big focal point for investigators, and the reason is the case rate and hospitalisation rate in India has plummeted in the last month or so. And the big question is why? Here's a big country, lots of virus was there, massive infections early on in this. And they think it's for a couple of reasons. Number one, they've done a big analysis of people both in cities and in the countryside, and as many as 50% were infected during the first series of outbreaks. Now of course this might protect them, and therefore they won't get reinfected and then the case numbers go down. That could be one reason. A second reason is in India they're inclined to have more pathogens in their system for various reasons, and again that might protect people as well. That's a second reason. And then of course the third thing is 6.5% of the Indian population is over 65. In Europe it's 20%. So again that might help because the death rate should be a lot lower as a result. And now they're wondering, has this pandemic burnt itself out in India? And has the rate of death and rate of hospitalisation then really fallen hugely? Time will tell, but very exciting developments in terms of India and COVID-19. And you can hear about these stories and more on my weekly COVID-19 update with Pat Kenny on Newstalk.